One of the key elements that we have to consider and to keep in mind when we're talking about cosmetic surgery is what is the expected outcome. Now, patients will come to a procedure or come to a consultation with a mind's eye picture of what they would like to achieve. And it's important to understand that we may not always be able to achieve that mind's eye picture. It may be unrealistic. And so it's very, very important to set these sorts of boundaries and set these parameters in place at the consultation stage before we even start with a procedure. This is most important. There's no point in coming to a surgical procedure with rose-coloured glasses. One must be open to what can be achieved and whether or not that's likely to satisfy what you're hoping to achieve. The issue of complications is something that is always significant. Even in the best of hands and in the best of circumstances, things can go wrong. Things just simply don't turn out the way we would like them to. And it's very, very important to discuss this issue of outcome and potential risk of complication before we start. The journals are full of lists of problems that we see with different surgeries. Admittedly, the likelihood of those things happening is very, very small, thankfully. And generally speaking, they can be remedied. But it's important to understand that that likelihood is there. One thing that patients often say to me is, well, what's the likelihood of that's happening? What's the odds? And my general response is that, look, it doesn't matter whether it's 1 in 100 or 1 in 100 million. There's always got to be that one. And how are you going to manage things if you happen to be that one? And I think that's a very confronting thought, but it's something that needs to be confronted and needs to be discussed before you start with your surgery.